You also have a situation where in some states, FEMA allocated ventilators to the states, and you have instances where in cities they're running out, but the state still has a stockpile. And the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. So we're encouraging the states to make sure that they're assessing the needs, they're getting the data from their local situations, and then trying to fill it with the supplies that we've given them. The same thing with the mask. So the N95 mask is actually an item that wasn't used as frequently in the medical profession before this. It was used mostly for diseases. So speaking to a lot of the doctors and hospital administrators, they would say they used actually a very low percentage of the N95 mask.
The program began in 1999 with the discovery of funding and the annual appropriation. The first operational driver was to create a capability to address the Y2K, or the year 2000 event, I think was the term used.
They were afraid that there was going to be an interruption of supplies to hospitals and to clinics, so they decided, the U.S. government decided to put together a cache of material that could be used to supplement those organizations if there was an interruption in supply because of the Y2K changeover.
The program was essentially non-existent. It was almost like building a plane as you flew it. And I remember there was a couple of people, we all started at the same time, and they were looking for SOPs. And I basically had to explain there is no SOP. This is putting a program together.
We were in a double wide trailer over at the Chambly campus. We only had a handful of people to start with, and we had a $50 million budget to create a stockpile. There were only a handful of threat agents we needed to be prepared for, and not too many casualties for any of the specific threats.
I remember our inventory starting out. We would be personally in the racks. We didn't have contracted staff per se, like where we have our 3PLs currently.
We had the resources that we needed, but the experience was largely unheard of. A lot of it was putting pieces together on the fly and making things that would work, both from a programmatic standpoint, but also from a regulatory standpoint, and then also serving the state and local partners.
I think the only thing that's been constant in the stockpile are the people, because our mission from 2002 to going into 2020 has taken on aspects of public health and response that we really didn't think we would do in the beginning.
The importance of the stockpile, there's two missions that to me are really the big piece. It's the big mission that everybody focuses on, the huge disaster where we're treating hundreds of millions. But the day-to-day stuff is what a lot of people don't see. So when a soldier has a bad reaction to a smallpox or someone's accidentally exposed to anthrax, we're the ones where the state or local governments will come and ask us to provide the vaccines to treat that person.
It's exciting to be part of an organization who knows our business so well that we can change and adapt and adjust to whatever is needed at any time. And everyone seamlessly and flawlessly goes from our everyday job that we are doing to support the stockpile into a response. We know what we're supposed to do. and we can just roll right into that, use our expertise from our day-to-day job, as well as what we've learned over the years as the organization has matured and evolved.
You find that common ground, and all of us have the same common ground, is to serve the people, to get them the medications they need to save their lives. And in an emergency, you always fall back on that.
We've grown, we've changed, and we have matured as a very strong, capable organization. We do supply chain logistics management that centers on the delivery of medical countermeasures to support the nation's health. We get the right thing to the right place at the right time, every time. And people rely on us to do that.
Without SNS, our public health readiness would be a very limited capability. Without SNS, I think it puts us at great jeopardy.
When I think about the next 20 years, I think about all the advances we're seeing technologically. I think that we'll continue to improve our knowledge and our input into the supply chain, and our understanding back from the supply chain about what it can do to help us accomplish this mission.
Over the past 20 years, our country has faced threats such as the events of September 11th, emerging diseases like Zika and Ebola, pandemic influenza, and devastating weather events like Hurricanes Katrina and Maria, as well as Superstorm Sandy. In the midst of it all, the readiness of the Strategic National Stockpile remained constant.